When you reach for groceries or twist in traffic, you apply massive kinetic forces to your body's central column. Your spine is the mechanical foundation for movement. It also acts as armored housing, protecting the delicate spinal cord inside. Many people picture the spine as a single uniform rod that moves as one solid piece. Treating your back like a singular unit during exercise is often why common stretches fail to provide relief. To understand why back pain persists, we have to look past that rod misconception and examine the two very different teams that make up your spinal column. The thoracic midback is your rotation master, allowing free twisting while anchored to the ribcage. Beneath it, the massive lumbar vertebrae are built for forward bending, but their joints align vertically like train tracks. Twisting causes the bones to collide, physically blocking the motion. When your midback becomes stiff from sitting, it loses that ability to rotate. The moment you need to twist, your lower back is forced to overcompensate, handling a rotational load it was never built to support. This mechanical trade-off, stability for mobility, is the foundation of spine health. To find relief, we must mobilize the mid-back while teaching the lower back to resist excessive twisting. We start by safely restoring movement with the supine lower trunk rotation. Lying flat on a floor provides passive traction. This decompresses the spinal joints and stretches the rotators without the pressure of body weight. Drop your knees to one side, keeping your shoulders pinned. Hold for 5 to 10 seconds, letting your obliques and lower back muscles safely release, then switch sides. For the mid-back, we use the seated hands-free trunk rotation. Sitting in a chair locks your pelvis in place. This eliminates lower body compensation, isolating rotation directly into your thoracic spine. Rely entirely on your core muscles to turn your torso. Never grab the back of the chair to pull yourself deeper into the stretch. This forces spinal joints past their safe mechanical limit. These stretches help break up mid-back stiffness. However, a highly flexible spine without the muscular strength to support it is unstable and prone to injury. Spine biomechanics expert Dr. Stuart McGill notes that effective core training isn't about bending the spine. It's about teaching the trunk to remain stiff and resist movement. The core-to-floor exercise builds this resistance. Lie on your back and pull your belly button inward toward your spine. This engages your deep abdominal muscles, turning them into a biological brace that supports the vertebrae. Now pause the video and try a pelvic tilt on all fours. Rock your pelvis back and forth between a deeply arched back and a completely flat one. Find the exact midpoint. This is your neutral spine. Maintain this position during the modified bird dog by extending one arm and the opposite leg simultaneously. Keep those green level lines perfectly horizontal, locking the back flat while your limbs move. Mastering this stabilization locks in the mobility you've gained. It creates a robust system that protects your spinal joints from harmful forces during everyday life. Functional health is achieved when mobility and stability are trained together. One allows you to move freely, while the other ensures you can move safely. As you practice this routine, remember that pain is a structural warning signal to be respected, not an obstacle to push through. If you have a diagnosed condition like osteoporosis, a herniated disc, or if your lower back pain persists for more than 2 weeks, consult a physical therapist before attempting these movements. This cheat sheet summarizes your complete daily routine. Perform 10 reps per side of the supine trunk rotation and seated twist to restore mobility, followed by the core to floor and bird dog to build stability. If you found this breakdown helpful, like this video and share it with someone suffering from back stiffness. Subscribe for more deep dives into functional mobility and joint health.